Welcome to this episode of Too Much Information, the women's health podcast where there's no such thing as oversharing. I'm your host, Izzy Warburton, and every week I sit down with one woman who's lived it and one expert who knows it for a no-nonsense conversation about our minds, bodies, health, and the stuff we've been left to find out on our own. We all know that women's health needs more airtime, and now is your chance to help us do just that. Take literally 1 millisecond to press follow or subscribe wherever you're watching or listening. For extra brownie points, you can leave a rating or even a review. And then check us out on Instagram. You can find us at 2.much.info.podcast. Like, comment, share, tag as much as you possibly can. It makes the biggest difference and it also makes my day. Enjoy the show. We are talking all about the topic of endometriosis today. And this is something that is close to my heart. Was about 10 years ago when my cousin, who I'm really close with, was going through a long old journey with endometriosis. I was in my early 20s at the time. This wasn't really something that we spoke about as a family, and it opened my eyes to this condition. Since then, I've realised how many people it affects, and Lucy, our guest today, is one of the people who it has affected. Lucy is a really good friend of mine. We've known each other since we were, 18, 19? And I'm so excited to be here with you today talking about this, Lucy. Please tell everybody a little bit about you and what you do in your day job when you're not on podcasts.
Izzy calls me Babs normally, so it's a bit funny to be called Lucy. But I am a speech and language therapist in London. I'm working with people who've had brain injuries and strokes. That's my day job.
This is actually your podcast debut, isn't it?
Very much so. I'm going out my comfort zone here.
I remember pretty early on in our friendship talking about, really anything to do with the body, bodily functions, health.
We've had a very open friendship.
Very open friendship, which is great. And you've definitely inspired me to do this today.
Oh.
So thank you very much for that. And then our expert today, coming back for the second time, is Fran Steyn. Fran is a fertility nurse. Fran, please tell us a little bit about what you do every day and specifically how often in a day or in a week you end up speaking to somebody about endometriosis.
Okay, so thank you for having me back. I am a fertility and women's health nurse. I've been in this specialty for about 19 years. Before that, I did sexual health. And at the moment, I am the head of service and I look after a fertility service in Wales. It's the only NHS fertility service in Wales. But to answer your question about endometriosis, I couldn't put a figure on it because endometriosis, we will get into this, doesn't cause infertility. But we have a lot of women coming through the clinic who do have endometriosis at various stages. And so we are often talking about it quite a lot, looking at what we can do to support people. And even outside of work, because, of the job that I do, friends are always talking to me about it. I've got a friend whose her teenage daughters have both got endometriosis.
Wow.
So we're often talking about things like that. So I tend to spend a lot of my spare time talking about it too.
Really interesting. And I don't know if either of you feel like this as well, or if it's just my algorithm, but I do feel like the conversation around endometriosis has got louder recently.
Yeah, definitely. I think there's much more interest in it than there was. There's so many people that are doing great work in this space now and campaigning for better care and better support, raising awareness, and people are listening.
Thank goodness. And what about you, Lucy?
Not seeing it much on social media, actually, but I think I'm having more and more conversations about it. And certainly before I went through the diagnosis process, it was never mentioned. I'd never heard of it. But since then, I think the more people I speak to, the more apparent that actually quite a few people do have this and have been through a very similar journey to me.
To kick us off today, we're going to start with a quick fire, and we are going to be period related again because why not? It's a great democratizer. I would like today for you to give us your biggest period mishap in 3 words or less.
I can go
I have
first.
so many. Yeah, you go first, Lucy.
The Shakespeare's Globe.
We need more information.
White trousers, standing, school trip, lots of boys.
Why is it always a school trip? How old were you?
God, 16, 15, 16?
Not a good time.
Not a good
Not
time.
a good time
White
for a white trouser
trousers.
period
No,
moment.
Never good.
Was it like a tie your jump around
It was
situation?
very much a tie that big old hoodie with my initials massive on the back around my waist and hope for the best.
I'm sorry. That's not fun. Fran?
I don't know, really. I mean, actually very recent, I'm 41, so something's happening. And very recently, I've had like 3 periods in 1 month, which is not fun. So, and my friend at work who's a gynecologist, and she's fantastic, says it's stress. And I'm like, really? I don't feel stressed. You are. I can see that you are. So I think, I don't have major mishaps, but it's when you're not expecting it, get caught short.
That's definitely longer than 3 words, but also
Sorry.
really interesting. No, it's absolutely fine. Totally fine. Well, thank you very much. I was trying to think about this because I think I've been quite lucky that I've had more issues about my periods not being there than being there when I haven't expected them. But one of the first times that I used a tampon sprang to mind, and it was on holiday with all the family present, and it just clearly wasn't far enough. So I went into the sea and just immediately felt this thing like expanding, really expanding. And I just had to U-turn it and go back because I was like, what's going on? Yeah, so there we go. All friends now. So we're talking all about endometriosis today. And I genuinely think we could make this episode into a 3-hour one because even just from the questions that we've had through on Instagram, it's clear that a lot of people want to know a lot of information. But Fran, I'm hoping that you can start by just giving us the basics. First and foremost, what is endometriosis?
Endometriosis is when tissue or fibres that are similar to the line of the womb, so what we've already got in there, grow in other places, but all grow on top of each other. So you might have womb-like tissue growing on your ovaries. That shouldn't be there. Womb-like tissue growing on your bowel. That shouldn't be there. There has been cases of endometriosis on the lungs, actually. So it's womb-like tissue which grows, and then it's very hard to stop it growing, and it can grow quite quickly too. So that, in a nutshell, is what it is.
What parts of the body can it affect?
It can impact your whole pelvic cavity. So the most common places is in the womb, but it does go on your fallopian tubes, can affect your ovaries, and cover your ovaries and cause scarring. Endometriosis can often sit in the bowel too and cause your bowel to stick to your womb, grow into tissue there, so it all sort of fuses together. And as I said, that you can get endometriosis that sometimes travels up your diaphragm and as far into your lungs.
What are the signs and the symptoms of endometriosis?
So the main ones are very, very heavy bleeding and a lot of pain. And when we're talking about bleeding and pain, it's not mild discomfort. It's excruciating pain, bent over double pain that you can't get rid of with paracetamol. Pain that doesn't go away. It's the sort of pain that you can faint from because it's that painful. And then similarly with the bleeding, it's heavy, heavy blood. You should, in a normal period, lose teaspoons of blood. With endometriosis, you're losing clots and often soaking through pads, tampons, anything that you're trying to use. So those are the 2 main symptoms. It can cause irregular periods, but the main symptoms are the pain and the bleeding.
Why are you bleeding so much more than usual with endometriosis?
That's a good question. There's still not enough research being done in this area, considering women have been living with endometriosis for years and years. It's the amount of endometriosis tissue you've got there often can cause the blood loss. So you've got it impacting your womb lining. So you're shedding your womb lining, so it can cause more bleeding and more pain that way. It's thickening all the time in the womb lining and it's coming away. So it's causing a lot more bleeding than you would usually see.
Lucy, listening to that list of symptoms, how many of those can you relate to?
Pretty much all of them. The only one I didn't relate to actually is the excessive bleeding. I don't remember thinking, oh, I'm having a heavier period than anyone else. If anything, I've always described my periods as quite light. But I think when I had surgery, which I'll talk about later, they found a lot of blood inside.
I think the other thing is we naturally think, actually, that's normal for us. The GP might say, oh, yeah, your period's just heavy this month, or that's the normal period. So we just assume it is. But yeah, sometimes when you do laparoscopy to look inside the pelvic cavity, you often find that the cavity is quite full of blood and it's drained because it stores it sits there.
Everything else absolutely spot on. And it's actually very refreshing to hear it described so succinctly. Is it worth saying what a laparoscopy is?
So it's surgery. It's a gynae procedure where you will have a general anaesthetic. They will go through your tummy with the camera and have a good look around. If they do see anything, they will take a piece of the tissue away so they can identify it and diagnose it. It's seen as exploratory, but if they do need to go in again and take any more tissue away through the route with the camera and the sort of like tongs and scissors technique to take away the tissue that they can.
How common is endometriosis?
Very common. So Endometriosis UK, their most recent stats said that it affects 1 in 10 women and girls, but I probably would say that it's actually higher than that because it's still misdiagnosed quite a lot. So as we just said, you go to your GP and say, I've got really painful periods and heavy bleeding. They might just put you on the contraceptive pill and say, and not actually diagnose you with endometriosis. So there's so much work to be done in this space. It really is. So the official term is 1 in 10, and that's globally. I think it's probably much higher.
Yeah. And this leads me very neatly onto my next question. When I was researching for this, the stat is saying 9 years. Is that right, Fran?
Yep. So I think on average between 8 and 9 years to diagnose endometriosis. We're just not good at it. And there's just not enough research or interest in it, really. I know we talked about it and it's getting better, but how many girls and young women are going to their GP and they are being fobbed off, unfortunately, saying, oh, that's normal, when it's not. So that's why it takes so long. And you can't see it, it's not, you can't see it physically, it's inside.
And is it true that it can only be diagnosed via surgery, or are there other ways of diagnosing endometriosis?
Officially, you'd need a laparoscopy to have a look inside the pelvic cavity and identify endometrial tissue there. But there's lots of new things being done now. So there's AI ultrasound, which you can have a look and it can tell you straight away. And your symptoms tracker, actually. If you are having heavy bleeding and excruciating pain, that's enough. That really is enough. Officially, in the NICE guidelines, yes, you have to have a laparoscopy to diagnose it.
Is it worth saying what a laparoscopy is?
And is that what you had, Lucy?
Yes. Yeah.
Can you grow out of endometriosis?
No, unless you hit the menopause.
Oh, okay.
So it's not curable. You can manage the conditions, but even with a laparoscopy, if you take away all of the endometrial tissue, it grows back, and it can grow back quite quickly. So you often find that if you are at the stage where you do want to try for a family, people have a laparoscopy and then told to get pregnant because otherwise the tissue returns quite quickly. While you're still in a reproductive cycle and of reproductive age, it can't go away unless you are in menopause and you stop having periods, or unless you have a total hysterectomy and remove the womb and the ovaries, which is drastic. But some people are in so much pain and just can't live with it. So yeah, you can manage it, but it can't be cured. And if there are people out there saying, come to me, I can cure your endometriosis, steer well clear.
And conversely, can you develop it in later life?
Yes, you can. You might have probably always had it, but it's not bothered you. So it's very, very mild form, but it can get worse as you get older. Hormones can affect it really. And as our hormones fluctuate as we get older, it can cause it to become worse and the symptoms to become worse.
Final question for you, Fran. Can you have children if you have endometriosis?
I want to be clear about this. If you can manage it, and you can, there's things that we can do to treat it and manage it and keep it under control, then you can absolutely go on to have children. You might need some assistance. You might need some, potential fertility treatment. Not always. As I said, some people get pregnant, and actually pregnancy itself can keep it at bay and stop it from coming back. But because of the damage it can do, because it can cause scarring, it can scar your ovaries, scar your fallopian tubes, scar your womb lining. So you might need to get some support from a fertility doctor or get some, further tests. So, I want to be clear, it doesn't stop you from having children, but it might, you might need some intervention. It might be a little bit trickier.
I want to also add in there, my cousin who I spoke about at the start of the episode, she has a beautiful, healthy little girl, which she and her husband conceived naturally. And I think she was really surprised that happened, but it did. So that is one of many good news stories that I know are out there. Thank you so much, Fran. Lucy, this is your big moment. I was trying to think of a way of you describing this that will make sense to anybody. And I thought, if you could describe this, but pretend that you are explaining it to Jason, Lucy's fiance, soon to be husband, explain for a man. And I think then hopefully the people with a womb will really understand it because they can understand at least that part of it.
The only thing I can imagine, and I've never had this happen, so I'm just guessing, is someone putting a knife in you and rolling it around inside you. Part of my diagnosis for endometriosis was the fact that the pain moved from one part of my body to another. So it started as a teenager, that stabbing pain would be in my tummy. And then when things really hotted up and I went back to the doctor several times, the pain had very much moved to my bottom. It would have been like, it was like someone had stuck a knife, not a nice straight knife, but one of those really serrated, dodgy zombie knives up my bottom, and was wiggling it around. It was excruciating. It caused me to faint a couple of times. When it was in my bum, for want of a better words, it was every time I needed the toilet, every time I needed to pass wind. Fran, what you said about being doubled up in pain, I would scream into pillows. I remember lying on the floor in my dad's living room, and he was mowing the lawn and he couldn't hear me screaming. I had to crawl to the telephone, pick it up, ring my mum, who was living in another part of town, to get her to come and help me because I couldn't move, I couldn't do anything. And I was just screaming down the phone. But I saw Vicky Pattinson, who was on Geordie Shore. She put up a video maybe a year ago saying, you know, when you get those shooty bum pains, and she was kind of a comical video, and she was dancing around her kitchen and being like, shooty bum pain. And first thing I thought was, that sounds like endometriosis. And I clicked on the comments, and all of these women had commented saying, that doesn't sound normal. That sounds like you've got endo. I think you should get that checked out. And I thought, yeah, that's exactly how I'd describe it. A shooty bum pain and being stabbed. Lots.
Wow, thank you. Yeah, graphic.
Sorry.
Also, no, so needed, like so clear. I don't think I've ever had a pain like that. To have that regularly is just horrific.
Yeah.
When do you remember first experiencing the pain?
Well, we talked about timelines and time of diagnosis. I worked mine out to 14 years. So to hear that it's 8 to 9 years, I thought, oh, that's actually quite good now. But I think when I started my period at 14, fairly drama free. And then the pain started every time my period came, was excruciating. I'd also just started going out with a boy for the first time. So mum took me to the GP and put me on the pill. They recommended the pill, partly for the pain, partly for contraception. Several years later of back-to-back pills. Periods I didn't think were too bad. They were just painful. And again, not really something I've talked too much about because everyone has painful periods. Mine were quite painful, but I think as the pain moved from my tummy around my body more towards my bottom area and became worse and worse. And when I started thinking, oh, I might take a break from the pill, so I'll come off it for a few months, that's when the pain really got unbearable. Twice I fainted on the toilet going to the loo in the middle of the night and woke up and thought, this is ridiculous. So I went to the GP, went to multiple GPs, was, cast aside as this is just periods, try this contraceptive pill. I should say my dad, my lovely, wonderful dad, is a GP. And I went to him. He was there throughout all of the journey and knows everything. And it didn't occur to him either. I said to him, I've looked up my symptoms. I think it could be endometriosis. And his word for word response was, oh, it won't be that. You don't want that. And it was dismissed and pretty much never talked about again until years later. Eventually, I went to a different GP, and it was this amazing South African lady. I'm actually going to give her a shout out. Her name was Dr. Nicola Thompson at North End Medical Centre. She was the first person who said, this sounds like endometriosis. Have you heard of this? And I said, no, what's that? And she immediately put me on the diagnostic pathway. And I had various different tests. I had some blood in my stool as well. So I've written it all down. I just couldn't believe how much I had in the lead up. But I had internal ultrasound, which I think is very normal. I had an examination of my rectum. I had a flexible sigmoidoscopy, which is a camera up half of the bowel. I had an MRI scan, and then eventually, all of those things can say, oh, you might have endometriosis. We've seen a little bit of thickening here, but they can't diagnose it, like Fran said, until surgery. So then I had surgery, I think 4 or 5 years ago now. I'm now 31, so age 14 to 27, probably 13 years later, had the surgery, and they afterwards confirmed it was endometriosis. So it's a long time.
That is a very, very long time. A long time, but not an unusual amount of time, which I think is probably the worst part, isn't it?
Yeah. sadly.
It would have been after we graduated from university and you talking about it. And just as a friend, I definitely remember you talking about the confusion and the journey and the lack of diagnosis, probably more than you did the pain. And I don't know if that's because that's something that you were more comfortable talking about, or if that's because that was equally as traumatic as this horrific pain.
I think I found that being on a back-to-back pill and not having a period was a way of keeping it at bay. So I would take 4, 5, 6 months of the pill back to back to manage it. So I could have gone several months without having had much pain, really. It was only when I then thought, I have no idea what the science is, but I should probably have a period now. It's probably good for you. And then the symptoms would come, and then I'd go to the GP, and then I'd be turned away, and then I'd have another 4 or 5 months on the pill. So it was, I think, partly not my fault at all, but partly because it wasn't happening every month, that prolonged it as well.
Do you remember a point where you felt it was taking over your life?
I think so all of the diagnosis and those little various medical procedures all happened in quite close succession within a few months of each other. And it coincided with not being that happy in my job and being single in London with every person I knew in happy relationships. So I think it was just a really bad time in terms of various situations that were not going that well for me. So it was really tough, better than anyone, Izzy. You were there for me more than anybody. And you recognized all of that and gave me so much support. So the point where I went on antidepressant medication, which is not something I ever thought I would be on. It's not something I've ever struggled with. I wasn't on it for that long. Thankfully, a few months later, I had the surgery and everything else improved. And I came off the medication after only a few months. But it certainly felt like without that, I genuinely wouldn't have survived. It was really bad.
You're going to make me cry. It's actually really interesting that you brought that up, because one of the questions that we had through from a listener was, is endometriosis connected to depression?
Well, it is. I mean, no one can live with that sort of pain. You can't live with that type of pain and what it does to you without it affecting your mental health. You cannot. It's absolutely connected. As women, our estrogen drops, our progesterone rises, so that impacts our mood anyway. And then imagine being in doubled over pain, fainting on the toilet, and not having anyone to be able to talk to about it, and thinking you're going mad because you haven't had a diagnosis and you've been put on a contraceptive pill and fobbed off again. I mean, it'd be completely abnormal if you didn't feel some sort of depression or stress or anxiety with what you're going through. So we need to normalise that completely. Yes, it's a physical thing, but it's very much an emotional thing too, and a psychological thing. It's all linked. You cannot have one without the other. Some people have told me, and this might be very different to the way you feel, Lucy, but once they got that diagnosis, it was sort of a little bit of a relief because they knew what it was.
I think that's so true. And even before the surgery happened, the laparoscopy happened and it was confirmed, I think I was pretty certain it was endometriosis. I think all of the clinicians that I came across talked as if I already had it, even though it wasn't confirmed. So I think a lot of my anxiety and I guess downward spiral was me worrying that it was going to impact my fertility, because that was everything that I saw when I researched it. It's what I discussed with my dad. And I was just petrified of where this was growing, assuming it was growing on my ovaries and in my fallopian tubes. And I think I just started a relationship at that point with Jason. But before then, I was single, and I remember thinking, I need to have a child really soon, and how the hell am I going to do that? Thinking, okay, well, what if it takes me another 2 years to settle down with someone, and then 2 more years before you get engaged, and then another 2 years before you get married, and then another 1.5 to 2 years before you have a baby, and that's just your first baby. And I was thinking, okay, this timeline is not realistic with what I know about, or what I've read about endometriosis. And that was really hard, really, really, really hard. But I was lucky in some way in that when my diagnosis was confirmed, when the surgeon came back to tell me what they'd found and show me pictures, they were sort of said, the good news is that your ovaries, your fallopian tube, your womb is clear, but we found a lot of endometriosis around your sacrum and your bowel. So that explains the pain that I had going to the toilet. My bowel had fused to my uterosacral ligament. It was making my bowel really small and tight, and so that's why pooing was excruciating. That's where the blood in the stool had come from. But I remember thinking, thank goodness my reproductive organs were spared. And I think that has taken the pressure off a lot. And being in a relationship where I can see that this is going to be hopefully part of my future in the near, fingers crossed, that has taken the pressure off massively.
Yeah. That timeline, just generally, that timeline for women is so brutal.
There is so much pressure. And actually, I want to come back to the comment about the pill as well, because this is why we have a lot of misdiagnosis for all sorts of things, because we're just putting people on the pill, and it masks a lot of symptoms. So, Lucy, when you say that, your bleeding wasn't very heavy, that might have been because of the pill.
Yeah.
And then when you come off of it, it's like, whoa, what is this? I think we've been abusing the contraceptive pill for many, many years in the UK because we just think it solves all the problems, but it doesn't. It actually masks a lot of problems. I just can't get my head around that it's 2025 and we're still doing things like that. And I think there's more talk now about when people are diagnosed with endometriosis about egg freezing, especially if it is the endometriosis is affecting your ovaries and your fallopian tubes. So you've got sort of, some sort of backup plan, but it's not funded. I mean, there is this wonder pill that was, recommended by NICE guidelines in May this year for people who've got endometriosis, a daily pill to take to manage the symptoms. It's called Ryco. People seem to be responding to it. So no more just contraceptive pill. You can take this pill, which actually just managing the symptoms.
I was recommended to get the Mirena coil, and I actually had that inserted at the same time as my laparoscopy. So 3 years ago, and I have not had any pain, any periods, the odd bit of spotting, but that's just normal. And so to me, the Mirena coil feels like a good option because of my experience. But is that true? If so, why does that work better than the pill? I don't know.
So the Mirena coil only has progesterone in it, really. So progesterone sort of tells your body to stop having a period.
Yeah.
Mirena coil, they often, insert them for people who are in perimenopause as well, to help with the progesterone levels. They're good if you are sexually active, because obviously it's a contraceptive as well, but they're not good for young girls. I'll say it because I am outspoken, but they are more costly to a GP practice than putting someone on the pill. So what you'll find is quite often is the GPs would rather put someone on a cheap contraceptive pill rather than offer them a Mirena coil because it's cheaper for them in terms of their practice finances. You're more likely to be told to take a cheap contraceptive pill.
It's just shit, isn't it?
It is.
It's really shit.
It is. I mean, too many times we end up saying that, but it's so true. First of all, Lucy, thank you so much for being so open. Just so glad to see you in a happier headspace with everything and with the diagnosis and knowing what's going on in your body. It's just the best. Can we talk a bit about the surgery? Because I'm sure that there might be people listening or watching who have been told that they most likely need a surgery or are waiting for a surgery and might be worried about what that involves. Would you be able to talk us just briefly through what it was like going into it, what the recovery was like, and things that you wish that you'd known going into that surgery?
Absolutely. I work in a hospital, so I should be completely fine with needles and surgeries, but I'm absolutely not. I'm faint at the sight of blood. I've never had a surgery. I've never broken a bone. I was terrified. And it was just so drama-free and not scary. I remember the last thing I remember was being asked what my commute was. And I think they must have been putting the anaesthetic in me whilst I was answering because I don't remember anything else after that. So it was all very smooth. They put a cannula in my arm to insert the anaesthetic, which is the thing I was most scared of. I'm proper needle phobic, but I was actually okay. I had it at Chelsea and Westminster Hospital. They were brilliant there. Everyone I met was just incredible and wonderful. And yeah, don't remember any of the surgery, obviously. Woke up in the recovery suite. Did have a slight complication. My Mirena coil had slightly twinged my vagus nerve. So I had a bit of a vasovagal fainty reaction, needed a shot of adrenaline, but I think that is very unusual and is more about me than about the surgery. I think it's supposed to be a day surgery. Should have gone home that night, but I was kept in hospital overnight for observations. I did get a little bit of an infection, was put on IV antibiotics for, I can't remember, 2-3 days, and didn't love being in hospital. Hospital food, yuck. Really boring, a bit painful, but honestly not as painful as I thought it was going to be. I had a friend who was told that her mum had to wipe her bottom after her surgery because she couldn't twist to wipe her bottom. So I'd prepped my mum. I said, "Mum, get ready. You're going to be going to the loo with me." And I don't remember any particular pain. I think it was just general slight discomfort, but absolutely nothing limiting. I was free to walk around, nothing like that. So I would say overall it was very positive. So I would say to anyone who is thinking that might be part of their diagnosis, it's not something to be scared of. It will be life-changing, hopefully for the better. I remember Googling laparoscopy scars and thinking I'm going to be hideous.
Yeah.
But no, I've always quite liked my belly button, and I've got a belly button ring. And I remember thinking, oh my God, I'm going to have to take my belly ring out and I'll have these whopping great holes in my stomach. And it ended up being 3 of the tiniest, teeny little incisions, the same size as a staple, but even thinner. And then a couple of dots either side of the scars where they did the stitches. And if I look at my tummy now, you wouldn't even know that I'd had a laparoscopy. It is so subtle. I've kept my belly bar. Everything looks exactly the same. Wish I hadn't worried about it.
Thank you for explaining that. I'm sure people will find that really reassuring, honestly.
It was just amazing to get the results afterwards, and they'd taken a lot of pictures inside, so I could see what you can imagine period tissue to look like in places it shouldn't be. And they have these things called gunpowder lesions, big grey sort of spots. It looks like you've been shot, I guess, and there's just this sort of gunpowdery scar amongst some webbed tissue. And I just was looking at it thinking, this makes so much sense. That's my bowel, and that is literally fused to that part of my body, and that is why I feel this type of pain in this particular place.
Yeah.
So all of that was fascinating. And when else do you get to see inside your body? I mean, it was cool. Although funnily, what you don't want to see, when I had my flexible sigmoidoscopy and they go into your bottom with a camera and your asshole is on a screen this big and you're watching it. And I asked to watch what was going on. And I thought, oh no, I regret that. That was not pleasant.
Oh. That's so good.
So you don't always want to see your body that close up.
It's just like every time I go in for any kind of a scan, they go, do you want us to tilt them? And I'm like, no, absolutely not. Keep it away from me. No.
You want to know your body, but not that well.
I know I really can't practice what I preach, can I? And since the surgery, completely symptom-free?
Yeah, completely symptom-free. I think in the last few months, I've had maybe a split millisecond of what feels like a very mild version of the pain I used to feel. That's maybe happened 3 times in 6 months. And I do think, I wonder if that's the start of something I should take notice of and be concerned about. But I would say other than that, absolutely symptom-free. Genuinely changed my life. Everything. Mental health better. Symptoms better. Everything. Just so much better.
I don't want to focus on the negative because this shouldn't be about the negative because it's really good. But let's be realistic. This is something that can and might come back, right? So as someone in Lucy's position, 4 years post-surgery, are there any warning signs that she should be looking out for?
Good question.
Thanks. Got your back.
I'd like to say no, but I'm going to be honest. I think that the Mirena coil is really helping you. I think once you take that out, you might find that it might come back a bit, the pain and stuff, because the Mirena coil is keeping it at bay. So if you do choose to start trying for a family, and taking the Mirena coil out, then you might find that you might be in quite a lot of pain.
Still, I need to know these things. Doesn't matter whether it's on a podcast or elsewhere, because I've been discharged from all endometriosis services. So, and I personally don't love talking about it. So this is really important for me. So is the endo still growing regardless of the coil? It's more just that the symptoms are less?
It probably won't be because the progesterone in the coil is keeping it away. But the fact that you mentioned that you felt some twinges, I mean, the Mirena coil doesn't last forever.
No.
So they do need replacing. So when the progesterone in the Mirena coil starts to wear off, I'm not going to say it will grow back, but you might be at risk of it growing back.
Yeah, that makes a lot of sense.
Yeah, so I'd definitely keep an eye on it. But I mean, the fact that when you did have the diagnosis in the surgery before and it was in the bowel only, that's good, because it's likely if it's going to do that, it'll come back in the bowel area, hopefully. But if it does come back, you might be absolutely fine. But I don't want to lie to you.
No.
Generally, just from the work that I do now, and because I'm dealing with people that are actively trying to conceive, it grows back within 6 months. You often find that this is why we say, have a laparoscopy and try to get pregnant, or schedule your IVF now.
Yeah.
Because it's so. I think when you are ready to start and you take the coil out, you might be absolutely fine. It does happen. You can be absolutely fine, but just to be aware of what could happen.
Yeah. I think all I'm thinking about is my partner and how challenging this has been for him, I think just one of the strains of the relationship, not so much anymore, but certainly in the first couple of years, was that he knew nothing, literally nothing about women's health. He has no sisters. He didn't grow up talking about it. He just knew nothing. And I think I was quite convinced when we met, was when I was going through all the diagnosis, and I was thinking, I need to have a child quite soon. And I was probably starting those conversations around families way earlier than he was ready. And still, he's not ready. I think I probably am not ready, but I do feel the pressure because of all of this. So I think it has been really hard for him. We've had big arguments, you won't mind me saying, where I've been like, we have to try for children pretty soon. And he's like, I cannot do that. That is not in my 5-10 year plan. I have got a career to build. I've got the world to travel. I've got all of these plans. Children don't come into it yet. So I've got no idea what my fertility journey is going to look like. I don't think it's going to be smooth. So I think the more open conversations that I'm having with him, and, him listening to this kind of podcast, I think will help us understand what we need to prioritize in life if we want a certain future. We will see.
It's really good to have those conversations about, future family plans. It's a really good opportunity to talk about other paths to parenthood as well, because, it's a possibility for lots of people, isn't it? Thank you so much for sharing that. It's eye-opening and really sad as a friend to hear everything that you've gone through in so much detail. And I hope that for you personally, going through this conversation, it gives you some answers. So that's what this part is about. You're here with Fran as an award-winning fertility nurse. Don't laugh, Fran, it's true. Now is your chance to ask any questions that you have.
One thing that I find interesting, what you were saying about whether it runs in families and if it's hereditary, because I remember my mum doubling up in pain in Morrison's when we were going shopping when I was little, and her just putting it down to period pain. I probably grew up thinking, oh, that's just period pain, that's what I get, mum gets that. But she's now, since I've been through all this, thought I probably do have endometriosis, because she had it her whole life. The lovely thing is she had 2 children, she's gone through the menopause, she's symptom free, but I do wonder whether she probably did have it, and how likely is it to run in females of the same family.
There is some studies to say that there is a genetic link, and she probably did. If she was in pain, and but then again, she was probably told that was normal. Periods are painful. Just get on with it. Especially in those days. I mean, no one spoke about periods, did they? So there is some research to show that there is a hereditary genetic link, but it can then skip a generation. So there's more research being done into it, but the link is there. And actually for other things too. So like fibroids. So if, your mum had fibroids, you're probably more quite likely to have fibroids too. So these uterine abnormalities or anomalies do tend to be hereditary.
And are there certain demographics that endometriosis occurs more in?
So actually, you find that endometriosis affects more Caucasian women, which is quite interesting because things like fibroids affect Afro-Caribbean women or Asian women.
And then my final question was, someone once told me, and I don't know how true this is, that the reason that endometriosis tissue grows elsewhere in the body is because it's not absorbed properly. When you have a period and you shed the lining of the womb, if there's any left that didn't get shed and expelled, that lining needs to go somewhere, so your body kind of reabsorbs it in other places. Is that utter bollocks?
Yes. That's a myth.
Good, just checking.
And there's all these myths that people will say, oh yeah, and especially I have to get on my soapbox a bit here about, TikTok and things like that. All the medical professionals on TikTok saying this is this and this and this. I'm like, you are doing so much damage to the world with your nonsense. But this is where we get these things from sometimes. A friend of a friend told me this because TikTok told her that.
The epidemic that I think we're really in is this epidemic of health misinformation. Just is scary.
Listening to your other podcast, Fran and Izzy, about PMDD and how there's other ways of managing that, for example, diet and exercise, is that something that can be used with endometriosis?
I'm so glad you asked that, Lucy, because this is one of the questions that we've had through.
Yeah. What should I not be eating?
It's hard. So you need to have a well-balanced diet. Things like processed sugars and all of those and chemicals that are in processed foods and all that jazz, they're inflammatory. So things like that potentially could cause its symptoms to be worse. I do firmly believe that, good nutrition and exercise, I'm not asking anyone to run a marathon, but there is absolute research and data to prove that exercise at different times in the cycle is really, really beneficial. Any type of exercise, physical movement, is good for pain relief itself. I mean, people always think, tell us to shut up because I'm in agony and I'm not doing any exercise, and I get that. But if you can, even a light walk will help, because not only will it help with movement, will help with the pain, but it will help with the emotional well-being as well. Getting outside if you can, but the movement will help with the emotional. But nutrition is key. There are so many good things you could be putting into your body diet-wise to help, and a well-balanced diet, like getting your nuts, seeds, pulses, anything that's got like good omegas and things in, and try to cut out all the processed crap. If you can eat and drink well, it would really help.
Definitely some changes I can make when it comes to processed foods. I'll live for it.
We'll do it though, don't we?
I had a question through from a listener, which was similar to what you've covered in terms of holistic methods of pain management.
Talking about holistic and nutrition, supplementation is also very important, because you might find that lots of people with endometriosis are anemic because they're losing a lot of blood. So making sure you're getting good iron and taking your supplements, making sure that you are taking multivitamin, but one for women, because it's got everything you need in it, and that will help. But you iron, your vitamin D, zinc, vitamin C, anything that help with cell production.
When your cramps or your periods or that stabby feeling are getting unbearable, is there anything that you have tried, Lucy, or suggested, Fran, that works?
For me, it was the similar stuff to what you hear about for period pain. So hot water bottles, warm baths were a godsend. A lot of breathing, some deep breathing when the pain comes, making sure that you're not holding your breath and tensing your whole body, but you're breathing through the pain. I don't think painkillers particularly helped, although having said that, there was quite a strong one that my mum used to take, and I had quite a lot of Ponstan, mefenamic acid.
Ponstan.
Whether that's still recommended, I don't know, but that did the trick.
So your mum does have endometriosis, or not anymore. If she was even taking that would,
That's so funny. I'll let her know.
I'm not going to, I don't want to be giving out medical advice on the pod. Just, I would say paracetamol does not work for this type of pain. You need something that's anti-inflammatory, but be careful, because if you've got a pre-existing condition that means you can't take anti-inflammatories, then please don't take it, or speak to your doctor. But you need to make sure that you're on top of it. So when it says take 2 tablets every 6 to 8 hours, take 2 tablets every 6 to 8 hours. Don't think, well, I'll give it another hour or another hour, because then you're going to breakthrough pain, which is going to be excruciating. So, don't overdose, but read what the instructions are. We'll do it. I might not need it. I won't take it, and then you get that pain. But, just be aware that, it says take every 6 to 8 hours for a reason.
So interesting. I never knew that. So I've got a final question for us to wrap up with. So we started by talking about the fact that it's on average 8 to 9 years for a woman to be diagnosed with endometriosis, which is probably about 8.5 years too long in my book. If someone is listening and they are convinced that they are showing the signs and symptoms of endometriosis, but they feel like they are being turned away or not taken seriously by their GP, what would your guidance for them be? How can they tackle this and make a change and advocate for themselves?
You've said that you need to advocate for yourself. See a different GP in the practice. Change GPs. Do not lie down and let them tell you that it's normal. Everyone knows their body. You know there's a problem. You know it's not right that you should be in this sort of pain every month. You've got to fight for it, and you've got to go in and say, actually, I know I've got these symptoms. And do your research. Keep your diary, your pain diary and your period diary, so you've got evidence to go in and say, okay, if you're not going to see me, I want to see a different GP at the practice. If they say there isn't another GP at the practice, say, okay, I'm going to change my GP. I know it seems like a lot of faff, but you've got to be seen. Do that. Demand to be seen. Demand that someone listens to you. Then you will find that if you do demand, they will take you seriously. But take the evidence for sure. So you can even say, look, I've listened to this podcast. This person told me this is not normal. So take all the evidence. I wish you didn't have to do it this way, but you do, unfortunately, in this day and age. So you've got to advocate for yourself and be forceful with it. Don't let anyone fob you off, because it's really, really important. Say, I know I'm feeling how I'm not supposed to be feeling. I need some help.
Completely agree with everything you've said. I saw I can picture 5 GPs. I can picture them very clearly. And I wouldn't say that whether it's a male or female GP makes any difference, because I can picture 3 female GPs that didn't pick it up. And it was the 4th female GP who I would consider one of my lifesavers and guardian angels, who just seemed to know straight away. And I think you can't blame GPs. They cannot know everything about everything. They are the first point of contact. It is not possible for them to know everything. So it's just bad luck if you get one who doesn't happen to have much knowledge or prior experience about endometriosis. You just try another one. And I mean, GPs are very happy to let you have a second opinion or help you with a second opinion. I lived with a GP. He is my parent and I love him to bits, but he didn't pick it up either. So it just depends on who you get. So yeah, try more GPs. I would think it was very different now, though. I can imagine it is extremely different compared to 10 years ago.
I really hope so. And I hope it continues to change at that pace. In this episode, we've spoken about new medications. We've spoken about AI that wouldn't have existed probably 3 years ago, let alone when you were going through this journey. I think the only way that you can remain hopeful is to keep thinking about how far we've come and how quickly things are moving. But equally, the science alone isn't going to help women through this. We have to stay strong and we have to keep plugging away and keep going back for more tests, as painful as it seems and as time consuming, and keep arming ourselves with the information that we need to make the best informed decision and to have our own backs, because sometimes it feels like the medical system doesn't have that. Thank you both so much. I have learned so much, Lucy. I'm honestly have more respect for you than ever, because you may have felt like this was all consuming, but from an outsider's perspective, it was not all consuming, and you were still able to fill other people's cups whilst going through all of this, which is admirable and incredible given what you've gone through. I'll be with you every step of the next bit of this journey, whatever that holds.
Thank you.
And Fran, thank you so much for making it all just as straightforward and straight talking as possible. I really appreciate it, and I know that other people will really appreciate it. And to anyone who is listening and who's on this journey, know that there is something on the other side of it, and it's better than it is now. That's it for today's episode of Too Much Information. You can find all our episodes on Spotify, Apple Podcasts, and YouTube. Wherever you're listening, just make sure you hit subscribe so you never miss a conversation. The links and useful resources from today's guests are in the show notes below, along with our social media handles and contact details. We are on Instagram at @TooMuchInfoPodcast, where you can submit your questions and get sneak peeks of upcoming episodes. Finally, if you know someone who might find this episode helpful, please share it with them, because that's how we get too much information to the people who need it most. Thanks again for listening. I will see you next time.